Hi all, thanks for stopping by my channel. Today I want to continue on my mental health series. In this episode I will go over some therapies for post-traumatic stress disorder and complex post-traumatic stress disorder. Here we have an overview of some of the therapies for post-traumatic stress disorder or complex post-traumatic stress disorder. Cognitive behavioral therapy, cognitive processing therapy, exposure therapy, EMDR, cognitive therapy, narrative exposure therapy, occupational therapy. Some of the most common medicines doctors might prescribe against post-traumatic stress disorder or complex post-traumatic stress disorder is SSRIs, SNRIs, antipsychotics, alpha blockers, beta blockers, MAOIs, benzodiazepines. Some of the innovative treatments can be virtual reality exposure, ketamine infusion, MDMA assisted therapy. Here are some self-help tips. Meditate, stay active, get a service dog, set boundaries, find a creative outlet, build a support network, try aromatherapy, mindfulness, and on to self-help tips for flashbacks. Focus on breathing, carry an object that reminds you of the present, tell yourself that you are safe, comfort yourself, keep a diary, try grounding techniques, for example, describe the surroundings out loud or count objects. There are three main goals for the post-traumatic stress disorder therapy. The first is to improve your symptoms. The second is to help you deal with the symptoms in a better way. And the third is to restore your self-esteem. When it comes to the types of medicines mentioned, the point is just to show that there are several different groups of medications a doctor might prescribe. People are different, so some medicines work good for some patients and other medications works good for other patients. So the doctor might try several different types of combinations before you get the result that is best for you. CBT or cognitive behavioral therapy focuses on the relationship between thoughts, feelings and behaviors. In cognitive processing therapy, you focus on how you perceive your traumatic event and how you deal with your thought patterns and feelings regarding to it. EMDR or eye movement desensitization and reprocessing. Here the patient thinks about upsetting images from the trauma while following the therapist's fingers in the air with the eyes. So you pick up a memory and disturb it with visual input to make the images fade away. Then there is exposure therapy. You can go either way of exposing the patients to a lot of triggers. So you create a flooding process. Or you can start gradually and build up to it. But in both cases you subject them to triggers and work on it and try to desensitize it and make the traumatic memories less and less. Then we have cognitive therapy. There you create a cognitive model that explains why people can't recover and get past the traumas. Another form of therapy is occupational therapy. There you focus on being active and creating and doing stuff and build on strengths. Then there is narrative therapy that focuses on rebuilding self-respect and value. Then we have innovative treatments like virtual reality, ketamine infusion, or MDMA. Basically you use this to make the traumatic memories less frightening, and that way you can get to them and work on them with a therapist. A lot of these things go into each other, so feel free to look up my other videos on anxiety and depression. When I make videos on these heavy topics, I will always put links to suicide prevention hotlines in different countries in the description. I hope you enjoy the content. If you do, please hit like and subscribe. See you next time. Thanks. Bye.